Imagine waking up one morning and realizing the signs of heart failure have been silently building for months, maybe even years, right under your nose. You thought you were just getting older, a little more tired, or slightly out of breath when climbing stairs. But what if those subtle changes were your heart quietly crying for help? The truth is, heart failure doesn't strike suddenly. It whispers through symptoms most seniors brush off as normal aging. In this video, we'll uncover the 13 early warning signs of heart failure that seniors must never ignore, because catching these early can be the difference between a long, healthy life and a sudden medical emergency. Your heart is an incredible organ, beating over 100,000 times a day to keep you alive. But as we age, it also becomes one of the most vulnerable parts of our body. After 60, the risks of heart failure skyrocket, not because the heart simply wears out, but because years of stress, poor diet, inactivity, and unnoticed health conditions begin to take their toll. Most seniors assume heart failure means your heart stops, but that's not true. Heart failure means your heart can no longer pump blood as effectively as it should. This means every part of your body, from your muscles to your brain, gets less oxygen and nutrients. And while it may start slowly, it can progress fast if ignored. Today, we'll break down the 13 subtle signs that your heart might be struggling, and we'll discuss what they mean, why they happen, and what you can do about them before it's too late. So grab a cup of tea, sit back, and let's make sure your heart stays strong, energetic, and beating beautifully for years to come. 1. Shortness of breath, even at rest. One of the earliest and most telling signs of heart failure is breathlessness. You might notice it when climbing stairs, walking to the mailbox, or even lying down in bed. What's happening inside your body is simple but dangerous. Your weakened heart can't pump efficiently, causing fluid to back up into your lungs. At first, it feels like mild fatigue or a lack of stamina. But if you find yourself gasping for air or sleeping propped up on extra pillows just to breathe comfortably, your heart could be struggling. Many seniors mistake this for getting out of shape, but when it happens consistently, it's a red flag your heart is waving desperately. 2. Unusual fatigue that doesn't go away. We all get tired, but heart-related fatigue feels different. You might sleep all night and still wake up exhausted. You might feel drained even after simple chores like washing dishes or taking a shower. Why? Because your heart isn't pumping enough blood to deliver oxygen to your muscles. When your muscles don't get the energy they need, they tire out quickly. Many seniors dismiss this as just aging, but that kind of deep, unrelenting tiredness could be your heart signaling it's overworked and underpowered. 3. Swelling in your ankles, feet, or legs. This is a sign many seniors overlook. Fluid retention, also known as edema. When the heart can't circulate blood effectively, fluid leaks into surrounding tissues, often pooling in your lower extremities due to gravity. If your socks or shoes feel tighter than usual, or if pressing on your ankle leaves a noticeable dent, your heart could be struggling to keep blood moving. Swelling might also appear in your abdomen or hands, but it most commonly starts at the ankles, one of the first visible warning signs of heart failure. 4. Rapid weight gain over a few days. Sudden, unexplained weight gain, even 2 or 3 pounds in just a couple of days, can mean your body is retaining fluid due to poor circulation. This is one of the underappreciated early signs of heart failure. It's not fat, it's fluid buildup. Your heart can't handle the normal flow of fluids through your body, so it starts to accumulate in tissues. Seniors often think they've gained a bit of weight from eating more salt or carbs, but if you notice this kind of rapid change on the scale, your heart deserves immediate attention. 5. Persistent cough or wheezing. A lingering cough, especially one that produces white or pink mucus, might not be a lung issue at all. It could be your heart. When fluid builds up in the lungs due to weak heart pumping, it triggers congestion and coughing. This cardiac cough often gets worse when lying down and eases when sitting upright. Seniors often treat it with cough syrup, thinking it's allergies or bronchitis. But when combined with breathlessness and fatigue, it's often an early symptom of congestive heart failure. 6. Loss of appetite and nausea. You might not think the stomach has much to do with the heart, but in reality, everything in your body depends on blood flow. When your heart struggles, blood flow to the digestive system slows down, leading to nausea, bloating, or a feeling of fullness even after small meals. If you notice you're eating less and losing interest in food, yet your weight is stable or increasing due to fluid retention, it's a strong sign your digestive system is reacting to reduced cardiac output. 7. Confusion or memory problems. Here's one most seniors never connect to heart health: cognitive decline caused by poor circulation. When the heart fails to pump enough blood to the brain, it leads to mental fog, forgetfulness, or confusion. You may find it harder to focus or recall names and appointments. Some seniors describe it as feeling mentally tired, but doctors sometimes mistake this for early dementia, but the root cause may be lack of oxygen-rich blood to the brain.
8. Increased nighttime urination. Needing to use the bathroom more often at night is another subtle sign. When you lie down, fluid that is pooled in your legs during the day returns to your bloodstream and ends up filtered by your kidneys. This creates the urge to urinate multiple times throughout the night, a condition known as nocturia. It's not just a bladder issue. It's a warning your heart isn't managing fluid balance properly. 9. Irregular or rapid heartbeat. Many seniors describe this as a fluttering or racing heart. When the heart's pumping ability weakens, it often compensates by beating faster or irregularly. You might feel it in your chest or neck, or notice your pulse skipping beats. While occasional palpitations are common, persistent irregular rhythms can indicate the heart's electrical system is under stress, often a precursor to heart failure or atrial fibrillation. 10. Difficulty sleeping flat. If you feel like you can't breathe easily while lying on your back and must prop yourself up with multiple pillows, it's not just discomfort. It's a classic sign of heart failure. When your heart struggles to move blood, lying down increases pressure in your chest and lungs, making it harder to breathe. Some seniors even wake up gasping for air in the middle of the night, known as paroxysmal nocturnal dyspnea, a medical emergency if ignored. 11. Cold hands and feet. Poor circulation means the body prioritizes blood flow to vital organs, like your brain and heart, while cutting supply to extremities. This results in cold, pale hands and feet, even in warm environments. If you notice your fingertips look bluish or your nails turn purple, that's oxygen deprivation. Your heart isn't sending enough oxygenated blood to your limbs. It's your body's cry for help, one that should never be ignored. 12. Persistent chest discomfort or pressure. Not all heart-related pain feels like the dramatic chest clutch seen in movies. Sometimes it's a dull, constant tightness, pressure, or heaviness, as though someone's sitting on your chest. This discomfort might radiate to your shoulders, jaw, or upper back. It can appear after meals, stress, or light exertion. While chest pain is often linked to heart attacks, persistent chest pressure can signal early-stage heart failure, especially if combined with shortness of breath and fatigue. 13. Swelling in the abdomen. Finally, fluid can accumulate in the abdomen, causing bloating, discomfort, and loss of appetite. This condition, known as ascites, is a sign your heart's right side is failing to return blood from the body efficiently. It can make you feel tight around the waist and cause your clothes to fit differently even when your weight doesn't change. This kind of swelling is a key indicator that heart failure has begun affecting multiple systems in your body. Why these symptoms are often missed? Heart failure develops quietly, often over years. The problem is, seniors and even some doctors mistake these early symptoms for normal aging, arthritis,
or respiratory issues. But heart failure isn't inevitable. It's preventable and treatable when caught early. Recognizing these signs early gives your doctor a chance to slow or even reverse the condition before it becomes life-threatening. What to do if you notice these symptoms? If any of these signs sound familiar, don't panic, but don't wait either. Schedule an appointment with your doctor. Ask for tests like an echocardiogram, EKG, or BNP blood test to check your heart's function. In the meantime, take steps that strengthen your heart naturally. Reduce salt to minimize fluid retention. Stay active with gentle exercises like walking or swimming. Eat heart-friendly foods like leafy greens, berries, and omega-3 rich fish. Stay hydrated, but follow your doctor's advice if you're already diagnosed with heart issues. And never ignore new or worsening symptoms. Even small changes can mean a lot. The emotional side of heart health. Heart failure doesn't just affect the body, it affects the mind. Many seniors feel anxious or depressed when they learn their heart isn't working perfectly. But remember, awareness is power. Catching these signs early gives you control. It gives you time to change your lifestyle, start treatment, and enjoy life without fear. Thousands of seniors have turned their health around simply by listening to their bodies and acting early. Your heart has carried you through every joy, every challenge, and every precious memory of your life. It deserves your attention now more than ever. Don't dismiss the signs. Don't say it's just age, because it's not just about living longer, it's about living better, with energy, clarity, and confidence. So if you found this video helpful, please give it a thumbs up, share it with someone you care about, and subscribe to Senior Health Tips for more videos that help you live stronger, longer, and healthier after 60.